Great. Thank you, Emily, very much. And now we can open up the dialogue to any questions and comments that folks would like to make.
Yes, thank you to all the presenters. I'm unmuting the presenters, and also Deb and Liz have been monitoring the chat box, and so they are going to be posing all the questions that have come through.
Sure. So this is Liz Salmi with OpenNotes. I've been monitoring the chat box along with Deb. And so the first question I have is from Kevin. And it says, and it was during Steve's presentation, but it says, could you clarify or specify exactly what documents are being shared with patients? For example, progress notes, psychotherapy notes, medication lists, discharge plans, etc.
Great question. And I should have been clearer. Everything we can see, the patient can see. So they can see their medications, their labs, their progress notes, their initial evaluation. There's nothing that I or any other clinician, anything we see, they see. There's one area where we actually, labs are, there's a lag time often between when if a lab is drawn, say on somebody that's going through cancer workup, those labs, there's usually a delay of like 3 days, business days, before the patient can see it. That allows the clinician to see it first, to be able to work up a game plan, to call the patient, etc. So a lot of systems have set it up where there's a little bit of a lag time between when the provider sees it and when the patient sees it. But in our system, we have the lags on the lab, but everything else, as soon as I sign a note, that note, the patient gets a prompt that says to them, you have a note to be read if you care to. And when they're returning for a visit, we have a prompt that goes out several weeks in advance of the next upcoming visit that says, you have an upcoming visit. Would you like to see your note from your last session to refresh yourself? So that's what we do, but it's all fully open, everything in the record.
Steve, this is Deb. So another question that came through was about pediatric mental health notes. I did mention in the chat that we will have another webinar at some point just about pediatric and adolescent notes, which is a whole area of discussion in itself. But if you want to touch on the mental health piece of that.
Sure, glad to. Yeah, that's been a trickier area. And in our hospital, in my end, we're only...
Well, while Steve is getting back online, I'll mention we had a number of amazing comments thanking Stacy for her presentation. And Catherine says, amazing work, Stacy. Your persistence and resilience are so apparent. It's wonderful to hear how OpenNotes has helped you in this journey. And then Shobha has also said the same thing. That was an inspiring message. So on behalf of all of us, thank you so much, Stacy, for sharing your story.
So I don't know what you heard or what you didn't hear, but about this. But Children's Hospital and a number of places around the country have opened up both on the medical pediatric side and on the mental health side. Anyway, they have done it in a way where it really tailors it towards the age. Most places do it so that someone that's over 14 or over 16, they have different levels of what they can or cannot see in terms of that. Because there's always the issue about how much can the parent see in that situation, or the surrogate decision maker. So that's been a tricky issue. Most of them are working it out and finding that it's working pretty well to give the adolescents in particular a lot more control over their notes, and that there's a lot more adherence and follow-up with their care, both on the medical and on the mental health side. But a lot of the data on that is a little bit preliminary too. It's a good question that Kevin asked.
So we got this question from Stephanie. I'm just kind of going out of order. I think it's important to bring up Stephanie's question. Maybe I should have done it first, but Stephanie asks, can you speak on how OpenNotes works? This is an actual documentation program, ? I work for a geriatric IOP at a rural hospital, and we are on paper charts and use electronic Word documents. Do patients have to have internet access at home to view the notes? Most of my patients do not have internet access.
So, Steve here, I'll try to tackle that. So I think that's a tricky question, because you're right. All of these systems are contingent upon internet access and a secure platform. So patients, don't just have they have to log in, and there has to be all kinds of security and protections, to the login process so that we can minimize any ability to have our systems hacked. And so that does make it a little trickier for patients that are not on the computer. That's been problematic in some regard. I will say that we have some studies out of OpenNotes that show that, in fact, actually a lot of our populations that are blue-collar populations that were less computer savvy have still loved having OpenNotes. Because sometimes it's another family member that's very savvy, and they can pull up the note. That person can pull up the note for them, and they can look at it together, or they can explain things. And a lot of times when people come home and they don't understand something that goes on, I think of my own mother-in-law when she was alive. Every time she came back from a physician visit, if my wife asked her how did things go, she'd always say everything was fine, and we'd ask if any changes. No, and then but if you looked at her notes. She might have hypertension. She's on a new medication. There was different changes at different points, and that's where, in fact, sometimes other care providers and caregivers can actually be very important for them to be able to see the note if the patient allows the access to it. But the paper notes is really a problem in terms of how do you do that? And before we opened up our notes online, I used to provide paper copies of the notes. I would print out my copy of the note if the patient requested it. But in our system, actually at Beth Israel, we've been on the electronic medical record since the mid-1980s. Is the very first electronic medical record in the world. So when we put on mental health notes online in 1991 was when we started there with that. So it's a bit more experience. It's tougher in some of the other areas that you're talking about, where we have to think about ways to kind of get notes available to patients.
Steve, a couple of questions came through about making corrections. So Shobha asked if you can talk about BI's process for chart correction if patients want to change their records. And then Jane, in a follow-up, said, has there been an increase in patient amendment requests?
So very good questions on both. There have been some patients that have asked about amendments or changes, and we once we have signed a note legally, we cannot change that note. It's not amendable in that way. But I will say that what I can do is you can add an amendment. Most electronic systems allow for an amendment to the note itself. So it's a legal document that's required. Once I sign it, it's done. But I can give you an example of a patient of mine who I put down in a note about how her son had completed his suicide, and I misidentified the way that he had done that. And that was very important for her, the way that he had done it. And so I amended my note to correct that. And that was, she was, I think, so grateful that I would do that rather than looking at the note and kind of stewing about it, that I could add on an addendum to that. And that's kind of the way we deal with that a little bit, is that, we can add an addendum or a correction. I went to see a physician for my own health not too long ago, a specialist, and he wrote down that I had quit smoking 20 years ago. Now, I'm in my 60s, and 20 years ago is very different than, in fact, actually what I told him was I quit smoking when I was 20 years of age. So that's a very different thing. So he had to do a corrected note. So he wrote a new note that corrected that information in the chart and added an amendment, an addendum to the original note. That's the kind of thing we can do, but we can't really change the note itself, unfortunately.
Steve, we have a couple questions from Simon, who identified himself as an Army psychiatrist, and that they are looking at sharing notes in behavioral health. And Simon says he's interested in learning more about sharing behavioral health notes as it pertains to sexual assault, TerraSoft forensics exams, as well as domestic violence, children, and any other resources around that.
Okay, that's a very interesting question, and I would say that for one thing, actually, the VA is one of our prime examples, because they've opened up their mental health notes both on the mental health side, both on the outpatient side and on the inpatient side. So they've done it there as well. So there may be a lot to learn there from, for Simon to learn from that experience. In terms of TerraSoft principles, and just for those that are listening in, that's kind of what we think of as the duty to protect or duty to warn principles that grew out of a California case, TerraSoft case back in the 70s. And Tarasoff has been kind of changed over the years, for the standards that we operate under, and it varies by jurisdiction. So here in Massachusetts, we use a clear and present danger standard. And generally what we've found is that when I've had patients, for instance, I do some forensic work as well, and the patients generally, I give them their notes, and I don't do it any differently. And when I have a patient who's very paranoid, for instance, or has had pretty unsettling thoughts, say homicidal thoughts or suicidal thoughts, I document. I have an obligation to document that. And I will usually document that what the patient has conveyed about their theory about what's going on, and then I usually say I have a different theory in my note. So, and oftentimes I will, with that population, I have tended to share the note with the patient before I print it out so they know what is coming. I mostly don't want to have them feel ambushed by something, and that's really what it amounts to. I know there are some staff in some of our systems who hold off on sharing notes until they're with the patient itself before they sign it. So there are some, if they're cautious about it, they'd rather do, it's like neuropsych testing. Many systems would rather have the patient come in for the appointment and really review all of the note and all that it means before they sign it. So some systems do, some clinicians do hold back on signing that because of the clinical reasons in that way.
Steve, Shoba had a question if you share mental health notes written by trainees such as psych residents.
Good question. When we initially embarked upon this, we did not share the trainees' notes. We now do. The exception in that is my social work trainees. So the psychiatry residents in training, they all share the notes. They are on board. The social work trainees, because they're operating under the license of someone, we've had some glitches where their notes are actually shared, but they're only shared once their supervisor has countersigned the note itself, because they're operating under that person's license. So that's when they are opened up. So they're opened up technically under the supervisor's license, but they really are the trainee's license, trainee's note in that way.
So that was all the questions in the chat box. It looks like we have a couple of minutes, Amanda, if anybody who wants any verbal questions that they want to bring up.
Oh, we just got one more question that popped in from Stephanie. Stephanie says, where does the responsibility lie with HIPAA if we are printing notes for patients to take home and read due to no access to internet, they leave our department and leave those printed notes in a public bathroom for anyone to see? Also, they are likely not being confidentially shredded.
Yeah, it's a good question. It's a very good question. And what I would say is that your responsibilities under HIPAA actually end once you give it to the patient themselves. But it's just like if for a staff person, that if I go to the bathroom and I leave the notes in there, if I printed out something on a patient note, that's my responsibility. And it's a reportable incident under most systems of care because that's a kind of a preventable harm, if you will. And and it is a HIPAA violation if, in fact, it gets out and it really discloses something and private information that should be protected. Once you give this to the patient, I mean, the patient basically, any patient can print out anything that we've done at any time, and they can send it to their friends, they can send it to their family members, they can send it to somebody else for a second opinion. So it really becomes part of their domain to kind of protect it. Part of the informed consent process that we do with all of this is we try to make sure that patients really kind of weigh out the need to be careful about their notes in those ways. So that's what I would say.
Catherine asked if you're conducting any formal studies or evaluations now, and can you tell us when we can look forward to hearing more?
Sure, it's a good question to get to. So we have two publications that should be coming out. We should get word on them. We thought we would have word on both of them this month, but we're waiting on that. So we have a couple of big studies that are coming out that should be out very, very shortly. And at any time, I should mention to everyone, on the OpenNotes website, you can get any of this. We have a mental health toolkit that you could look at any time if you want to see what that looks like and use that or think about the ways that it could be helpful to your practices. There is the literature is in there, so we keep that up current. So all the literature that's come out of the OpenNotes movement is on there. We try to keep that in process so that any of that is there for anybody to look at any time.
We're getting more and more questions, which is so great. And as you were talking, Steve, Catherine said, are you conducting any formal studies or evaluations right now? If yes, can you tell us when we could look forward to hearing more about them? And then you answered that as she was asking that. And then she says, thank you. A new question, though, is from Stephanie. Does anyone require a patient to sign an extra paper form before their mental health notes will be released?
I'm not, say that question again, Liz. I'm not sure.
And maybe, hopefully my inflection is right. Does anyone require a patient to sign an extra paper form before their mental health notes will be released? So maybe are there extra protections to notify patients, FYI, you will now have access to your notes?
Yeah, there is not. I mean, I think what what that speaks to is that the worries that folks oftentimes have about practicing, making sure that we've covered all of our bases and we're practicing in a way that we kind of protect ourselves. And it's really a fear of litigation that I think arises from that. Our sense is that, in fact, actually, I mean, there's an informed consent process for all patients when they go enter our system. Our system is, the platform is called Patient Site, the web-based format where they can pull up their medical record, and the OpenNotes is simply the notes itself that's there. That we don't do any additional informed consent process of them, other than just simply going through about the need to make sure that when they walk away from their computer, they don't just leave it open, that somebody else could go in and look at their chart if they want to be careful. So we do, address that in those ways, but we don't have a separate consent in that regard.
Steve, there is a question here. It's probably pretty quick from Kathy. She says, you may have covered this earlier. My apologies if that is not the case. What do you recommend regarding substance abuse treatment notes? We are currently not opening access to these due to federal regulations and how we interpret those. Any thoughts?
Yeah, glad to. So I actually think that's I think that's a misinterpretation of the way HIPAA regulations are, and very common in the substance abuse realm. I don't think there's any reason to hold back notes in that way. And what I would say is, if we learn anything from the self-help programs, particularly Alcoholics Anonymous, which has been just amazingly successful for so many years, it's that the transparency and the openness. So you think about it, like the main criteria for recovery is honesty. And the ability to kind of look at oneself and do self-examination and to be open to feedback from others. So when somebody has a concern, it's a cognitive behavioral approach usually that, in fact, actually, I think OpenNotes lends itself especially well for the substance using populations. And I know we have an opioid clinic here at our hospital, and they very much, their notes are open, and patients really feel that they benefit from it. It's like going to a meeting for them sometimes when they read their notes. So that's kind of what I would say. I think it's a concern that I hear about regularly from a lot of different practices, and I don't think that that's a correct interpretation of HIPAA regulations in that way.